Hey, I'm sorry I had you leave the other day, but I just wanted to finish up on what we had previously talked about at our previous meeting. I just want to go over chief complaining. So you presented with severe low back pain and kind of your right hip joint is what you said, kind of right there is what you said. You said that's been going on for about 2 months. As long as that's true, we're going to go forward with that, and we're going to treat that specifically. You said some concerns is the increasing intensity and symptoms. About 2 weeks ago, you saw your massage therapist and your OBGYN, and they said not to do anything active for these next couple weeks until your due date, correct? And just need to do less and stay off it. You said you've not had any pain with your past pregnancies, anything like this, so that makes this a little bit different and so a little more substantial, and so we're going to approach it as such. Some of the physicals we did, Kemp's kind of testing for some bulge disc, and Gainsland's was testing kind of your pelvic pathology between your hips and your ligaments. Some things we did notice when you were standing is that you were leaning to one side. That was very substantial information, as well as when you walk, you're kind of more like a short stepping. And then also when you bring your hips out both ways, you had some trouble with resistance, which I think you saw. What this is kind of leading me to believe that you have a right-sided disc bulge about somewhere in your low back, and that's then you said radiating to your right sacroiliac joint, or kind of your right buttock area. So we might have a trapped nerve or something like that that coincides with this right-sided disc bulge. So that's why I believe it may be causing some muscle spasms as well, as which is what you're feeling, and is why this is happening this time and not the other times. And then at your age, it's between 20 and 40 is when a lot of disc bulges happen, when your discs are still hydrated. So this is a very common thing, but that's kind of what I believe is going on. And if you have any questions, feel free to ask me about it. From what I understand, that you're under a lot of stress, your husband's working a lot, the kids are going crazy. This obviously doesn't help with that. But what we're going to do here is we're going to try to adjust you. What we're going to try to do is decompression if we can get you in. The red flag is obviously that, it's radiating a little bit, so may have to take imaging later. That may be substantial. But some exercises we're going to work on. The typical treatment for a disc bulge is decompression and McKenzie exercises. What we're going to have to try you do, if you can decline in any way. So I'm not sure how practical this is for you, but anything that would get you, just let it hang here, or something, maybe some pillows or something that would allow you to kind of decompress off this low back, something more of that nature. McKenzie exercises is going to be more extension of the low back, so we're going to focus on, we're going to work on core and low back at the same time. So what we're going to do here, so bird dogs, we're going to do opposite foot, opposite arm, 3x10, but we're going to try to hold more in between. The other is basically just Superman's. Not sure if you can see that, but focusing on that low back as well. We're gonna take this, we're gonna see how this goes. Obviously you have limited time with the pregnancy and everything, but this is how we're gonna tackle it, and feel free to let me know if you have any questions. Thank you so much. Bye.